If you grind your teeth and you've been considering Botox as a solution to this problem, then this video is for you. So stay tuned. Hi everyone, my name is Dr. Degha Fongod. I'm a cosmetic physician in the Northern Virginia area, and today we're going to be talking about the use of Botox in the masseter to help with teeth grinding or bruxism. So before we even talk about Botox in this area, let's review a little bit of anatomy of the area. So there are 4 muscles that are responsible for chewing, or muscles of mastication. You have your temporalis muscle, you have your masseter muscle, and these 2 are the biggest muscles. And then you have your medial and your lateral pterygoid muscles. So these 4 muscles are responsible for the chewing mechanism. What happens when you overwork a muscle? Let's say you go to the gym and you're trying to get your booty right. If you work out your muscle a lot, eventually your muscle is going to get bigger and you're going to have a nice plump booty, right? But whatever. Same thing happens with your masseter. So when you grind your teeth a lot, what can happen is that the masseter muscle can actually get bulky and bulky. And so when that happens, it can change the shape of a woman's face. So you might naturally have a very slim jawline, but as you keep grinding your teeth, your masseter muscle is just going to keep getting bigger and bigger and bigger. And what ends up happening is, for some women, it's going to give them a boxy appearance and it's going to make them look more manly. All right. So a lot of Asian cultures typically will use Botox in this area to slim the jawline to give you a more feminine look. But it's also a solution for people who suffer from bruxism or teeth grinding. So before we talk about whether or not this is a good idea for you, it's important to understand a little bit about how Botox works. So Botox is a neurotoxin that basically relaxes muscles, and it's typically used in wrinkle reduction, right? So if we're able to use Botox in this area, then we're gonna basically paralyze the muscle and decrease its function. And so in doing so, your muscle of mastication, or your masseter muscle, is not going to continuously get a workout, and so it's not going to keep getting bigger. And so if that muscle isn't being used, which is what happens when Botox is injected into the muscle, then it's going to atrophy or shrink. So like we said earlier, when you work out your muscle, in the case of clenching, it's going to hypertrophy or get bigger. And so when we use Botox in the area, it's going to atrophy or shrink. And that's going to give you the slim jawline that you probably originally had prior to grinding your teeth. So here are some things that you need to know about getting masseter Botox. First of all, it is really important that you go to somebody that understands not only how to inject in the area, but understands facial anatomy, because there can be some bad consequences that can occur as a result of using Botox in this area. So the first thing I would say is you want to make sure that whoever is doing the treatment is conservative in their treatment approach. So for my patients, I never do more than 15 units per side to start until I understand how their body metabolizes the neurotoxin. If you put too much of it, what can happen is that the muscle can atrophy so much that it can completely change how you look, and it can really look terrible on some people. Another thing that can happen with masseter reduction, or using Botox in the masseter area, is that some people can actually get jowls or worsening of the jowls. So let's say, for example, you have a very big muscle here with your masseter muscle, and I shrink that muscle. Well, what's going to happen is that the skin here is going to become much looser, and it's going to make you jowl in this area, right? And so for a lot of people, the saggy skin actually makes them look older. So it's really important that, again, this area is not over treated, so that you don't have to worry about that happening. And if it does happen, then most of the time you're going to have to do fillers in this area to try to bring the skin back up, which is a very complicated process. So the best thing to do naturally is to be very conservative in the treatment approach. So no more than 15 units. when you're starting out. And I would probably want to do this treatment every 6 months. Some people are slow metabolizers of Botox, which means that it's going to last longer in their body. And so you don't want to treat them very frequently because you can, again, atrophy the muscle and actually, which will make them look even worse than before. Okay? So in summary, when you're getting Masseter Botox, it is important to make sure you find somebody that understands facial anatomy. It is important that when they're doing the treatment, they are very conservative with the number of units that are being used so that they don't cause really bad atrophy. And it's important to understand that for some people, they might get sagging of the skin, and it's just something that you want to pay attention to and weigh your risks versus your benefits. If you're in the DC metro area and you're looking for a cosmetic physician to help you with Masseter Botox, then I will leave my information below. But share this video with somebody that might be considering Masseter Botox for jawline slimming or for teeth grinding, and I'll see you on the next video. Bye!